Thank you.
Okay, so this project is What Are We Waiting For? We are a group of people who work in health, work in IT, who just sort of came together yesterday morning and started talking about problems and came up with a problem. So our problem statement is coordinating different steps in patient healthcare is difficult, it's complicated. And if there are any delays in those steps, that's inefficient and costs the NHS money. The hypothesis we're looking to test with this is find out what patients are waiting for in hospital, make the data about what they're waiting for available to decision makers, and they can make decisions about more efficient use of resources. We thought about inpatients, outpatients and day patients, but we decided to just focus on inpatients for this to sort of narrow it down.
Okay. So we were conscious that we only had 2 days, so we set our aims quite low. What we wanted to do was actually deliver something that we could trial and learn something. So we didn't want to do a proof of concept and need another few months. We wanted to get something ready to trial. So we wanted something very simple to adopt, so a hospital can use it straight away. We didn't want any integration requirements. We thought that we'd just ask a junior doctor to do a few extra steps, and we make all of that data for all of these delays available to anyone who wanted it. We decided to build on top of an existing product, Opal, which is already in use in some hospitals. Hopefully that makes it easier for hospitals to adopt and for us to get to trial. So what we're collecting for, so again, very minimal data points. What is the patient waiting for? What time did it get requested? And when did we get the results and were they reviewed?
Oh yeah, so this is just an example patient journey. So this actually happened to me. So I broke my toe, I had to go to A&E. I had an x-ray requested, I had to wait for the x-ray, then I was admitted, I had to wait for surgery rounds the next day to decide I did need surgery. Then I had the surgery, then I had to come back round because I had general anaesthetic, so that took some time. Then they requested a physio, but because it was so late in the day on a Saturday, the physio wasn't available until the next morning, so I had to spend the night in hospital. Once the physio saw me, then I was checked out, but there's possibly some inefficiencies in this journey. I could have maybe freed up a bed for a night. So this is a demo of the thing.
Okay, so we just wanted to show you how the data would actually be entered. So if we log onto the system, so this might be a junior doctor on the ward, maybe doing this as part of the audit, or so they can log on, they can see a list of their patients. Let's go into this one at the top. So they're going to enter a discharge step. Maybe this patient they've just requested some hospital transport for. And that's now. And then a little bit later on that day, maybe it's taken a few hours. Then that step's completed.
Cool, and then we just have some really basic graphs to look at that. So this is sort of the amount of time, the amount of each thing that are called. So we've got blood tests being called 3 times, ECGs 1, echo 1, but despite that, this is the number of minutes, so you can see that echoes, for some reason, took 5,030 minutes to respond, and we've got all of that data for transport, specialists, imaging. I think this bit could do with some work, but it's a good basic display.
Any questions? Stunned silence. No. Question from the team, team.
I have a question for the judges. So we built this as a trial. We'd actually like to try it. Can you help us make that happen?
Well, I think the answer to that is a little challenging, I think. We need to have a look at it actually, because I like the way you've actually sent the data, and I'm giving you a point for using Betty Rubble actually tonight. So on a serious note, we just need to have a look at it, but it seems a very useful product.
Yes. Oh. I guess my question would be, as a junior doctor who might get asked to sort of fill out this data on the report, is a lot of hospitals will use internal sort of computer-based ways to request all this stuff in the first place. would it be possible for you to link your system into that in the first place to save any duplication of labour?
So it's got all of the REST APIs. It's very easy to do that. But I'm not going to pretend I can fix NHS integration of systems. But in theory, it's very simple. It depends on who's providing that.
So we wanted to go as low cost and low impedance to actually trial and see if the data improves the utility. Once the data is useful to somebody, we can then ask IT to do the expensive changes required to make that kind of integration. So we just wanted to get started. Because it might be the data's useless and that you can have the best integration in the world but you're not going to learn anything. So we want to learn, prove, then ask.
The classic, are you asking the right question? Question?
So I think what, as a medical student who often ends up being the monkey who does all of the typing, well, what I'd love is if there was a way for us to get the information into the system which didn't need a human to put it in.
So that's what we've just kind of talked about. I mean, essentially, we've aimed to get the information in within sort of within. I think you should be able to get it in like under 4 clicks. Like we have looked at that kind of timing. So days times are always defaulted to now. So you add, you've got autocomplete for that, reviewed, save. So that's.
Sorry, I think what I meant is without even having to do that is the right way.
So what we were discussing a second ago was that essentially NHS integration is really difficult. It does have REST APIs. We can use token authentication. We can, like, in theory, writing it is very simple for whoever is providing your external systems. In practice, I don't know who they are, and obviously there's a lot of other work around that. And that's why we wanted to make sure that we were collecting the right data, and then probably move to integration. But I agree, that's something that we've all been worried about when.
Because what we've potentially looked at as well is forming into a to-do list of task management. So as opposed to having a piece of scrap paper with your hand over saying you need to go see such and such and your bloods, ECG or whatever, you could, by adding it to your to-do list, it would automatically add it to this. So it would save you having a piece of scrap paper telling you the duties you've got to do. But again, integration.
Yeah. So yeah, I mean, we've been quite pessimistic. We're absolutely not against integration. We thought about it. We're prepared to spend some time to make it happen, but only after we've proven that the data is useful to somebody. So if there are bed managers, staff managers, clinical specialists, if they are using this data and they have value in that data, then we can spend extra effort to make it better for junior doctors.
One last question.
If you're sitting in a trust that sends out a constant stream of HL7 messages when things happen, do you pick those up?
Yeah. So I mean that would be like there would be some sort of integration, but exactly that is what we'd be kind of aiming for. In my experience, a lot of different versions of HL7, different people implement HL7 in a different way. But that is exactly the kind of yes, if people are up for giving us HL7, we'd be happy to put it in.
So you then pick off the order box.